Let's have a look at this very bizarre story about this government inquiring about making smoking even easier than, they've already done the smoke-free 2025, but making it even easier now. Let's have a look.
Our Deputy Prime Minister enjoys a smoke, but what Winston Peters has long rallied against is the rising cost of ciggies. Now New Zealand First's Casey Costello is thinking about freezing the annual tobacco tax increases.
The increasing financial burden on this demographic.
Do you notice that title? Health Minister. Health.
Oh, Jesus Christ.
This is Health Minister. And can I just say, I was scraping my brain before we came on, Chewy. At the end of last year, there was a very big deal made about the by the National Party about the appearance of a conflict of interest. Remember those conversations we were having? And how bad it was, and the appearance of a conflict of interest was as bad as the thing itself? We'll keep talking about that as we go through. We'll keep going.
Financial burden on this demographic has been really painful, and unfortunately it is our Māori and Pacifica communities who are carrying that burden.
She's asked for advice from health officials.
If there is a reason to look at...
Yeah, sorry, I misparaphrased. I said making it easier to smoke. What they desperately want is to make it easier for Māori and Pacific to smoke. That's actually what it's about as the Associate Health Minister.
That's even better.
Yeah, much better.
This is fantastic.
Gold, isn't it?
At freezing that excise while we work through getting them away from smoking.
It's a move that's left some appalled.
Shows the government's got their priorities wrong.
Excise taxes are the most effective way we have of getting people to quit smoking.
Over the last 20 years, the price of a packet of cigarettes has quadrupled. In 2006, a pack of 25 smokes cost about $12. 5 years later, in 2011, a pack cost over $16. By 2016, they cost $28 a pack. Now, they cost more than $50.
Fuck!
I had no idea they were that expensive. $50 for a packet of cigarettes. And you don't think that's going to stop people smoking? You can see why it's the most effective. $50 for a packet of cigarettes. I had no idea.
Paying more than $2 per cigarette, up from about 45 cents a ciggy 20 years ago.
Over the years where the cost of tobacco went up in New Zealand, we saw some of the biggest decreases in smoking rates we've ever had.
Actually, the alternate products providing quit smoking strategies have been way more effective than increasing the price.
But this anti-smoke...
The other thing is, and I don't talk about this in the interview, so I'll mention it now. When we went over this last time and the downward trend of smoking, right? The downward trend that we're already in. And National has all been saying the whole time, well, that we're going to continue that downward trend. Well, a big factor of that downward trend is increasing the price. So if you stop increasing the price, then you stop a big portion of that downward trend. So what they're saying is we're going to keep focusing on getting people to stop smoking by taking away probably the most effective thing we've got, other than making it smoke-free, to stop people smoking. So it's just another one of these, Mr. Luxon's always about, production and what is the outcomes and stuff. And this outcome is, I think the official word is horse crap for what they're trying to do.
Smoking group wants the new Associate Health Minister gone.
Just does not ring true that she's in it for smokers as opposed to in it for the tobacco industry.
Well, I don't have links to the tobacco industry, but that...
But you work for the Taxpayers Union, right?
I was on the chairperson board. I had no involvement of any funding from the tobacco industry.
Casey Costello is far too close to the tobacco industry, despite what she says.
The government's tobacco moves continue to ignite controversy.
All right, Benedict, what's the Ministry of Health had to say about all of this?
Well, I imagine officials at the Ministry of Health are a little bit red-faced tonight, and that's because confidential documents from the Ministry made their way to a media outlet showing that Casey Costello had sought information about this tobacco tax freeze. Now, the Ministry says they've now launched an internal investigation into this leak, and they say that they take the unauthorised disclosure of government documents very seriously.
Oh, yeah. So it's all about, as it always happens, it's always about how did this information get out rather than what is this information all about. Now, Chewy, I know you'll have lots to go with, but we've got someone from Health Coalition Aotearoa who I talked to about this. I thought maybe we'll play it because only 8 minutes. I know we can hold our jets for that. Maybe we play this first and then we can come back. So any of your thoughts, put them in your little. I know the red head fires pretty hard these days. but put them away, and we'll get to this conversation I had at about like the reason. And I say to people who are our patrons, we get our interviews up first. I actually recorded this at 8:15 this evening, so there was no time to get it up on the old Patreon. So we'll just go to it now. It's 8 minutes long, and this is Health Coalition Aotearoa, who are one of the groups who are basically going, WTF, people, what is going on with this government? Let's have a listen. Let us welcome to the show Professor Boyd Swinburne. I believe you're one of the people who started the Health Coalition Aotearoa group. Boyd, is that correct?
That's correct, and I'm co-chair.
Co-chair, very good, and thank you for giving us some time this evening. Fascinating story, and we're recording this in the evening, but me and Chewy have just watched this story from One News, so we're kind of up to date with what One News reported tonight, which, if I can synopsise again very quickly, it seems that the Associate Health Minister has questioned what would be the ramifications or effect of freezing the tax being paid on cigarettes. So she's doing a bit of a question and inquiry as to what would happen if we did this, and that document's been leaked, and that's what we're responding to. Is that a fair synopsis?
That's a fair synopsis, yep.
Okay.
But this is on top of a few other things that she's done, which we can cover, but yeah.
So let's look at it. Let's ask this question first of all. What is Health Coalition Aotearoa, and kind of what skin have you got in this game to be talking about this conversation?
So we're an alliance of 45 or 50 health organisations that want to improve health and health equity in New Zealand through a reduction in consumption of unhealthy products, especially tobacco, alcohol, and unhealthy food. So it's the medical groups, health groups, consumer groups, community groups wanting to get better health and health equity in New Zealand.
Oh, excellent. Okay, so I guess to go right to the nub of it, let's just say that these investigations by Casey Costello led to a government wanting to freeze the tax on cigarettes. What would not increasing tax on cigarettes do? Like, what would be the outcome from that, in your opinion?
Well, it would make cigarettes progressively relatively cheaper because they're not going up with inflation. Right. And we know, if we know one thing for certain, is that people respond to prices. And if the prices go up, then people consume less. If they go down, they consume more. And that's pretty well established for tobacco. And so we would expect that tobacco consumption would not keep going down at the same rate that it is. You know, New Zealand has been tracking down for some time, which is great. And we want to accelerate that. And the current laws in place will accelerate that. But this will help to flatten those out, if you like. And it's just anti-health. It's it's anti-health.
We've had this government cancel Smoke Free 2025.
Yep.
We have a tobacco lobbyist as a minister right now, Chris Bishop, whose father started the taxpayers unions with connections and links to the tobacco industry. Casey Costello has just come from the taxpayers union as well.
Yep.
They're now looking at making cigarettes still be available. That's already been decided, but now cheaper proportionally with them, as you say, not going up. Why? What are your thoughts around why this is happening?
Well, I'll tell you what, it's nothing to do with. It's nothing to do with evidence. It's nothing to do with public health people are calling for. It's actually nothing to do with what they campaigned on for the election, you know.
Yeah.
All this was a complete surprise when it came out in the coalition agreements. So everything that they have called for, the repeal of those smoke-free laws, wanting to bring in smokeless tobacco, chewable tobacco for which there's no demand, wanting to take the excise tax off the heated tobacco, now looking at dropping the CPI adjustment on tobacco. All of this is 100% straight out of the tobacco industry playbook. That's what they've been calling for. And the tobacco industry will be very, very happy with the state of affairs in this government about what they're doing around tobacco. And it's just amazing that we have a health minister who's doing all these anti-health things. I've dealt with many health ministers in the past. I don't think I've seen so many anti-health policies or ideas come out of an associate health minister in such a short space of time.
They keep talking about, out of one side of their mouth, that they still have a plan for reducing smoking, Well, out the other side of their mouth, they're giving us all, making cigarettes more available and more easily accessible. They keep talking about the reducing of numbers. Is the prices going up? Does the research show that's a good way to slow down smoking? In other words, if they don't increase the prices by the tax, is that a reduction of people wanting to pick it up? I'm saying that badly. You know what I'm saying? It's like, does the increasing of price, does that lead to fewer people smoking? That's what I'm asking.
Yeah. So the relationship between price and consumption is very well known. I mean, we've had so many tax rises and tax hikes and see reductions in consumption that relationship called the price elasticity has been well worked out. Now, in New Zealand, we had many years of hiking up prices far more than CPI, like 10% or plus a year. It started with the key government, and that has really cranked down tobacco consumption in this country. Now, it does get to a point where that starts to run out of oomph. In other words, it becomes progressively less powerful as you get up to the level of taxation that we have at the moment, where a packet of cigarettes costs, what, $45? But by the same token, if you say we're going to make it relatively cheaper because we're not going to adjust it for CPI, you can be sure that that will have an effect on increasing consumption or not bringing the consumption down as fast as we would like it. So, that relationship is well known. It's a bit nuanced in terms of the size and magnitude of it, and we haven't had those really big increases for the last few years. And I think that's a sense that we've come kind of to the end of the really heavy carrying load of the price rises. But still, it needs to go up by CPI.
I think, I think I'm evidence of this on some level, that when I was a teenager in my younger days, working at a petrol station part-time while going to university, you could buy packets of 10 cigarettes. I remember them, Paul Malls, you could buy 10 packs. And they got outlawed, of course, because they made them more accessible and more easy. If I was a teenager today, looking at $40 or whatever it is for a packet of cigarettes, you're right, the price would be a deterrent for actually having to get them. I just want to ask you one more quick question, because you mentioned that they are using tobacco lobby talking points. So for real clarity, let's be gracious and say that the government is not doing the will or the whim or the calling of the tobacco industry. Are you saying that what they are looking to put in place would do nothing but leave the tobacco companies happy, even if they're not aware of what they're doing?
The tobacco industry will be really, really happy with what this government is doing. It is totally out of their playbook. It's what they've been calling for. The links between this government or people within this government and the tobacco industry you've mentioned, I think they're on public record. How much that influence has been direct in what these policies are, it's pretty impossible to tell. But boy, you just look at the pattern, you just put the pieces of the jigsaw together that we know, and that gives you the wider picture.
Professor Boyd Swinburne from Health Coalition Aotearoa, thanks so much for joining us this evening.
Kia ora, thanks, Pat.
So there you go, Chewy. There's the story, and there's part of the response from some health professionals. Shall I throw you the ball? Off you go, sir.
How compromised are these people? Do they think we're stupid? That someone that's involved with a lobby group that is funded by tobacco, has no links to the tobacco industry, and the first opportunity she gets to come out with some policy, she's like, I think we should do this for the benefit of tobacco companies, but I'm only thinking of the poor brown people that like to smoke, because everybody knows they're the only ones that like to smoke. It's just so stupid. And then what was it? She denied it, and then denied it again, and then proof was produced that she did do it, and then she denied it again. What an idiot!
Yeah,
it's unhinged. That this is the change that we've had now, is that these people are just going, well, yeah, we've had a good run of ramping down smoking. We're just not going to do it anymore. There's no reason for it. No reason for this massive shift. Don't look into it. Please don't look at my LinkedIn. I have nothing to do with Philip Morris. It's unhinged.
Remember as well, and I'm just bringing this to our attention, we had Sir Ian Taylor on last year. And one of the points he made about the smoking situation was this government is setting up an incentive to create more smokers. And like whether you enjoy that interview or not, or didn't like him talking or not, he made a point that basically said this government has a benefit, a financial benefit, because they need to find money for all their promises to have as many people smoking as possible. And this is now the second quite significant, this is just an investigation for them, but quite significant way that will quite easily lead to more smokers. Obviously, cancelling 2025 is the biggest, but now also making it so it's more affordable, not necessarily cheaper, but $50 today. If it was still $50 in 5 years, then because of, wages going up and all that, that will be cheaper proportionally. So they're making it easier to smoke. And you just kind of go, what's the next one going to be? Things come in threes. The first one is they'll cancel smoke-free 2025. The second one is we'll make cigarettes basically cheaper. What's the third one going to be? So it's actually, I know what the third one's going to be, and I've been seeing it in the chat, although I haven't started any of them. Winfield's going to start sponsoring the NRL again. Rothmans is going to start doing, because that'll be the next thing that the government brings in. These are three things. We're
going to get rid of school lunches, and we're going to replace them with a free pack of 10 cigarettes for every kid. I remember being absolutely stunned when I went to Europe the first time, just to see how much people smoked over there. And I remember going to a music festival, and they had, where the stunt people jump off the tower into a great big inflatable crash pad.
Yep.
They had one of those set up, and I thought that's fucking cool. I'm going to do that, and it had marketing down the side of it for a cigarette company. And I went over there, and I was like, I want to do the thing. And they were like, cool. And
here's your free packet of cigarettes.
Well, it's basically like that. They were like,
really?
Have you been drinking? And I was like, oh, a little bit, but not, I'm not drunk. And they're like, do you have any health issues? No, I'm fine. Do you smoke? And I was like, no, I don't smoke. And then they're like, oh, well, you can't do it because you've got to buy a pack of cigarettes to jump off the thing.
Oh my God.
And I was like, what? So, I mean, this is the thing that New Zealand has been spared.
Yeah,
by going so hard after the tobacco companies. Like we've crossed through to a point where people are standing up for the tobacco companies who have a long history of being absolute fucking scumbags. And Philip Morris can fuck off. But now we have Chris Bishop with links to the tobacco company. Almost a family history of links to the tobacco companies, actually. And now we've got standing ministers and associate health ministers with strong links to the tobacco companies. And we've let that happen. So that's brilliant. I'm super stoked for that. And I guess this is what they meant by get New Zealand back on track.
But that's the nickname for cigarettes. Assume. Track. Get them on track. I'm just having a look because I'm interested. It looks like a packet of cigarettes in France, because I just thought, I have my cigarette while I'm sitting in my cafe. It's going to jump to €13 by 2027. And basically the euro is double New Zealand. So that's still, by 2027, $26. So the cigarettes are half the price in Europe that they are in New Zealand as well. So there you go. More accessible, easier.
You might know, Pat, I was recently in North America.
Oh, well, yeah, I've never heard that.
And in the two states that I was in, they have legalized cannabis.
Mm-hmm.
And it was more common to smell marijuana just walking down the street than it was to smell tobacco smoke.
Yeah.
Crazy.
Yeah. A few messages that have come in. Paul says, so stopping smoke-free laws won't hit Māori and Pacifica communities, but excise tax on those smokes will. So they need to put a hold on it. Yeah. What a load of bullshit. That she's basically saying we want to protect Māori and Pacifica to enable them to smoke more.
Just absolute bullshit.
Just how, I almost admire the cheekiness of that. Costello was also a founder of Hobson's Beach. Oh, I wasn't aware of that.
So a multi-layered scumbag.
Yeah. Yeah.
Now associate health minister. That's awesome.
Yeah, yeah. And Nick's just sent another one through for $2. Thanks for the super chat. In Cairo, they're $1.50 for Winfields. Holy moly! So the Middle East are even cheaper. Yeah. So you got to say, I mean, I know I've just said this, and I don't mean to repeat myself. Well, I sort of do. But the idea that one of the main drivers behind our declining use is the increasing price. This government is allowing and making it easier to smoke left, right, and centre, while still saying we're going to continue to decline the use. But hang on, if this goes through, that's one of the main drivers to decline use. So not only would you then be making smoking more easy and go on for longer by cancelling 2025, you're also taking one away, potentially, one of the drivers that has caused that declining use. And we still have no outcomes from Mr. Luxon as to how they will drive smoking down whilst making it more available and cheaper, Chewy.
And this isn't a left or right thing. This isn't a Labour or National thing. We're looking at decades of almost a consistent level of we have to attack this problem. It was multi-pronged. You know, it was getting them out of advertising. It was plain packaging. It was increasing the price. It was making it easier to access stock programs and that sort of thing. It was this multi-layered attack. Everybody acknowledged the harm that tobacco was doing. And now this government, the first government that I can recall, someone's going, oh, okay, we're going to do less of this now. And it's almost like, oh, we're so close to the finish line. Just walk it in. Just stop. Have a breather. Have a cigarette. Don't cross that finish line.
Have a breather, but be aware it's going to be much harder for you to breathe with that emphysema. But have a breather anyway with your oxygen tank.